I'm your host, Jason Radisson, and today we have a remarkable guest whose career spans healthcare, corporate governance, and community leadership. Joining me is Mary Brainerd, the former CEO of HealthPartners, the largest consumer-governed healthcare organization in the country, with more than 100 hospitals and clinics and 26,000 employees. She's chaired the Minneapolis Federal Reserve Board and currently serves on the board of Stryker. Mary was also one of the founding CEOs and chair of the Itasca Project, collaboration of civic and business leaders focusing on the long-term economic development of Minnesota. Mary, welcome to the show.
Oh, thanks so much, Jason. I'm glad to be part of it.
Mary, you've spoken about your management philosophy, and one of the phrases was alignment, not sameness. It's such a memorable phrase. I'd love it if you could unpack it for us.
It actually does sum up pretty well how I think about at least some of the aspects of leadership, because especially in larger organizations, but I'd contend any size organization, anything that you want to accomplish, you want to have be sustained. And that means it can't be my idea, my way, my approach, or even that of a senior leadership team. It really needs to fit with what people think is the right thing to do, connects with their own sense of this is what I'm here for. And so what I found was if we were all aligned on the things that we think are most important, what's important then is to make sure that it's delivered in many ways. So through people who have different points of view, diversity of thought, diversity in all dimensions, makes change sustainable and successful. And so I always felt that if my role could be more working with and through people rather than managing people, the changes and what we wanted to accomplish would happen more successfully.
So it sounds like also a way of empowering.
Yeah, absolutely. So in healthcare, in order to have a great birth experience, for example, that's not the same for everybody. So what you want is a healthy baby, a healthy mom, a good experience, and delivering that baby really well. And that actually requires a great degree of adaptability. It takes into consideration many points of view, takes into consideration many different forms of families. And so doing one thing the same way, you might say this is the best way to deliver a baby, but you'd be wrong because it's much more complex than that. But if we all have the same result in mind, we get the job done.
Excellent. Well, I'd like to switch gears for a second and maybe talk a little bit about your origin story before we go deeper into leadership philosophies. I'd love to learn more about your own path. How did you get to healthcare and ultimately to the CEO role?
Yeah, I had a very indirect path. I was a philosophy major in college, and so one summer I needed money and credits, and I ended up applying for an internship program that landed me at the Minnesota Department of Health, so public health. And when I got there, they had lots of easy fits for people who were in public health nursing or environmental health, but what do you do with the philosophy major? And so I lucked out and ended up working for the Deputy Commissioner of Health, who was a woman who became a role model really for me. She was also the leader of the Public Health Association in the state of Minnesota. So I then also lucked out, and the person who was planning the public health conference left the state, and they didn't have any hands to turn that project over to. So I got to learn a lot about public health. I got to learn about health issues in Minnesota. I was able to learn from someone who is immensely talented and a wonderful leader. And that got me started. Eventually, I learned I needed more than a philosophy degree to progress in healthcare and do things that were more relevant in the field. So I went back to school, got a graduate degree, and then literally started working for Blue Cross because I figured it was kind of business and kind of healthcare. And then got more. I had already worked in healthcare delivery, worked on the healthcare financing side through Blue Cross, and became convinced that the best way to change healthcare would be to be in a place that both delivered care, because you can't change healthcare delivery without actually connecting with the care itself. And also, you can't really change healthcare if you've got a broken business model. And so I wanted to work in a place that also could affect how the financing took place. And HealthPartners does both. In model, it's somewhat similar to Kaiser Permanente, so both a plan and a delivery system. And I thought that was really a gift to be in a place that had all of the tools at hand to try to create a successful healthcare system. And I mean successful from the perspective of the people using the system.
Any advice that you might give our listeners on how you knew the right timing of those career decisions and those moves?
Yeah, I wish I had some helpful comments to make. I think maybe more than anything else, I was opportunistic, tried not to say no to things if I could see how I could learn more. I think probably many people go through strength finders. I'm a big learner, and I kept looking for ways to open doors to learning rather than following a specific career plan or career path. Really never envisioned myself as CEO of anything. I envisioned myself as doing something that was compelling personally, and I was fortunate that the two coincided.
I remember reading that you went to the convent of the Visitation High School, and I remember reading about the Salesian tradition there. There's the saying of bloom where you're planted. I think it's a way of saying to find the encouragement in everyday life, kind of an organic process of moving forward and helping people. Do you think that impacted you? Was it that experience in particular in high school really helped form you?
Yeah, I would say it was very formative, and both the bloom where you're planted, but equally going to a school where, particularly back then, I think things have changed now. But at that time, I went to a school where every single role was assumed by women. So all the leadership roles, not just with students, but in running, of course, not their board of directors, but all the leadership in the school were women, not all nuns, but a number of them were. And so I had the good fortune of being exposed to leadership as practiced by women at a time that was really important in those formative years. And so I never saw, oh, well, a woman couldn't be a CFO, because I'd already seen one. And, a woman couldn't chair a board of directors, because I'd seen that too. And so I think sometimes the things that get in your head that keep you in certain spots or close doors for you mentally were less present for me because of having had that experience.
Do you think it's unique in healthcare, the role of women in leadership?
Yeah, good. I mean, again, I was fortunate enough to have that first internship experience where I was reporting to a woman in leadership, but you can't help, and this is still, it's kind of bizarre. It's still sort of true today. You can't help but walk into a hospital or a clinic, and 80% of the people there working there are women. And still, there are fewer women in leadership than I would expect. I continue to say and think there's good progress, but it's still notable, just like it is in corporate environments.
As someone who's worked with Fortune 500 companies, I would say in C-suites and boards, we may have made a few steps forward in, ratios on boards, and then it seems some years like we've just gone backwards. Mary, I know you've spoken publicly about your cancer diagnosis in 2000. If you're comfortable sharing, how did that experience help shape your perspective on healthcare, on leadership, and frankly, how you show up as CEO?
Yeah, that was a life changer. I mean, I would say both for me personally, but it also changed my thinking about my job in some hugely significant ways. I mean, what I learned, I had breast cancer very early stage. And at first I learned it's a physical disease, sure. It's a hugely emotional disease. And it's not a disease that you have by yourself. It's a disease where you bring your family with you. I was lucky to have mine caught so early, but the minute that you hear a word like cancer, it just changes how you think about your life. And it really changed how I looked at healthcare. I can remember going in for a lab test, and I would look at the lab tech and think, does she know something that she's not saying to me? Or how scared do I really need to be? Or can she just tell something by, what I've had before, that this is not going right? Or, you would take things so personally, so seriously, and with so much fear, that it helped me see that the people walking through our doors in our clinics and our hospitals every single day, you don't know the story that the person in front of you carries. And even how people would say hello, I would wonder, oh wow, do they know, like, I'm a cancer patient here? So it just made me even more aware about the importance of every single touch point from a human perspective, not from a science perspective or a tech perspective, but what's the quality of that human interaction? And it made me really committed to try to make sure that the quality of those interactions were viewed as important as the healthcare science component. I remember going to Medtronic. They do patient interaction events, and everybody in the company participates. And so at the end of the day, whether you're working on keeping the facilities clean or whether you're the CEO, you're reconnecting with that sense of purpose and commitment to patients. And I began to feel like, yeah, the people in our emergency rooms, they see that and feel it. But does the person saying hello in a clinic, or does the person paying your claim also see the human impact of what they do, and really tried to influence that in the culture?
I think the Medtronic approach sounds like a fantastic way to bring along the employees. I remember reading that you had commissioned a play at the time to help your employees better understand the journey. I'm curious about that moment.
Yeah, well, actually, the theater piece was the result of some learning. Again, you look at how do other people learn? And what we began to learn, and there are plenty of psychological tests now that would evidence this. People in finance might learn best through data and reporting and information, but nurses clearly most impacted by storytelling that helps them connect with that sense of purpose. And so we began to think in terms of motivation for change. We were changing how we were delivering the care, but also changing the technology that we use in the ways that we use the electronic medical record. And what we were hearing was skepticism. This is going to replace one set of technology solutions that aren't very good with another that probably won't make things any better. And so we began to think of how could we show how it could be better, and do that without using numbers and reports and PowerPoints. And so we decided to use theater. And again, I think you mentioned earlier the importance of that shared experience in seeing how things connect and how they can be was really helpful. And it also, interestingly enough, got people to the point where they would challenge more openly. And I always think that's a healthy thing, so that use of theater really made a difference in helping us have the kind of interaction that I think really leads to improvement. So it was really fun. It was very hard to do, but it was really fun.
I bet. Another point that really stuck out in terms of HealthPartners and a model that maybe listeners aren't familiar with is being consumer governed. Could you share some examples of how that model impacted your work?
Yeah, HealthPartners began literally as a co-op. So 4 regular people decided, how can we make healthcare better? And they thought for themselves and their families. They thought, well, really 2 ways. One is we could hire our own doctors and nurses, and the second would be if we would have our own health plan. And so out of that, they started gathering people literally in neighborhoods. University of Minnesota had quite a bit of involvement early on. Some of the faculty got involved in creating the organization. So as it got big, it converted from a literal co-op to a not-for-profit with consumer governance. And what that means is actual elections for the board of directors. They were contested elections, so you had to be willing to put your name up and run against somebody and say what you stood for and what you planned to do if you were elected to the board. And we had people from all different walks of life. An elementary school teacher always had some or more than one person, retired consumer, not like a retired audit partner, so it was... Clearly they looked at some things differently than many corporate boards would. Really had to talk about what should that bottom line look like. People get that you can't lose money, but how much should you make? Mm-hmm. And in a world of thin margins in healthcare, it made it challenging as a management person to hit those targets because they were small to begin with, and your margin for error was not very significant. Where we would grow, what communities we would serve, I think all directly impacted by the perspectives of the board members who served. So it was, and also you weren't dealing with the audit partner. So if you're talking about investments that you're required by law to have and how you use those invest those investments, people have a lot of different points of view and levels of sophistication. You had to make it make sense to somebody who viewed themselves really as a consumer of healthcare services.
But kind of like a dual bottom line with community impact and the finances of keeping the business running. How'd you define success in that?
Oh, that's a very interesting question. And one that we ask ourselves. First of all, where do you measure a bottom line? Do you measure the bottom line for each hospital? Do you measure the bottom line for each clinic? What kinds of incentives do you have in place? At what level? So we looked at different corporate models and tried to measure but not reward necessarily at the micro level, and instead tried to have the most significant emphasis on the whole system so that you weren't having a hospital say, well, I don't want to lose that level of testing to a clinic because I make money on that test. And I don't want the clinic to get that revenue stream and that profit margin. And managing that is challenging, and also figuring out how it might stand in the way of innovation. Very fortunate to be in a place where we didn't have to only do profitability by small business unit, and instead could stand back and look at a little bigger picture and say, it makes more sense to use this new technology that maybe costs more on the go in but reduces length of stay over time. Those kinds of decisions were a little bit easier in the environment where I was.
Mm-hmm. Making it easier to deliver the kind of experience that we'd want as consumers.
Yeah. I don't mean to sound like it was easy or perfect, because it's not.
Mm-hmm.
And I don't know of any place where it ever will be, but I felt like the struggles were worthwhile and the purpose was compelling. And so if you were going to spend your career fighting certain battles, those were the ones I wanted to fight, even knowing that there's always going to be a way you can be better.
Thoughts about the applicability of that model going forward? Obviously, the profits versus impact and care tension exists, and who knows where things go now. But do you see bright spots on the horizon, or do you think that a lot of what we're going to be dealing with these next 4-8 years is going to be related to that?
Well, that's such an important question, and I wish I had a better answer. I worry that we're still in healthcare recovering from COVID, and I think there were many steps forward that had been taken, and we had to walk backwards because shortages of workforce, people leaving healthcare, particularly in the hospital setting, many, many retirements among physicians. So shortages on the horizon. And maybe that will result in some creativity, that when you're short of the human resource, you find other ways of using technology and AI and other forms of innovation to fill some of those gaps. But I think we're at such a tension point around coverage issues that I do believe there will be solutions to that. And it may not solve it all, but I don't think we're going to back away from that. Has to happen.
Yeah. One of the things that I've appreciated about the challenge in healthcare is when I speak to healthcare leaders, we haven't been able to bend the cost curve with technology. We haven't seen
True.
it. We're hoping with this wave, as we look at all of the changes technologically on the horizon, agentic AI probably being the main one. If you could play it forward, do you see the role of the healthcare CEO changing? Is it too early to tell, or what might be some of the ways that the job changes?
Well, I think certainly I view the CEO job as kind of an ensemble performance. If one person thinks they're doing it all, that would be a sad statement, because it's truly a team. But I think within that executive team, it clearly calls for greater understanding of the connection between AI and other technologies. I put robotics in there too, and quality and outcomes, patient safety, patient experience, all of those other dimensions of care, and figuring out how rapidly to implement some of those solutions, and I hope some are implemented rapidly, and others where it may be important to slow down. But I think having that level of knowledge and sophistication easily available on a go-forward basis is going to be critical, because there are so many innovations, and it's like which ones, when, and how.
Yeah, I think what I've seen in my experience is some degree of gatekeeping. Vice presidents of AI in major systems and at large corporations who
You bet.
I think at the moment are just fielding all of the internal requests and trying to figure out where to plug in new technology. But still, my sense is also very early days.
Yeah, so do you see
Yeah.
models that are emerging that are more effective than others?
I'd say across sectors, it's not hitting the same departments at the same pace. I think we've seen acceleration in marketing probably being one of the very first places, and
Yep.
customer experience, customer service, places where there's a great upside from automating, and whether there's a robot on the other end of the chat or a human matters maybe less than it might in a physical environment, person to person. There's also spreadsheet work where we've seen just great advances in computer science and computer programming, where, at least if I speak from my own experience, we've seen about a doubling of productivity over the last year with just the tools that are available. My feeling on AI at the moment is we're a breakthrough away from it being super disruptive. The thing that we can all agree on is we're not prepared. Now we have the accelerationists are making key decisions. We'll be likely less prepared than we would have been otherwise.
Yeah.
I don't think we have to be fearful of it, but thinking through the implications is really paramount right now.
I just think in healthcare, the shortages are significant enough, and at least from what I can see in changes to the pipeline of professionals, we're not going to fill the gap.
Right.
And so any technology solutions that will help with that, and frankly, that will help healthcare professionals who are really needed in human form to be able to do the most worthwhile parts of their work, and leave the others to technology, that would be a dream come true. But I am really hopeful about that.
Yeah, definitely seeing it in corporate, like I said, with marketing. I think
see that too.
You could say that supply chain has been a 20-year process. Supply chains have been fairly robotic, automated, with the exception of people picking and packing.
Yeah, for sure.
The routing of packages hasn't been human-driven for a long time. We'll see how things develop here. I do want to switch gears for a second and talk about your role on the Itasca Project, and I think that's such an interesting and unique project overall in the United States. I think there are a few markets where you would see 40-ish government leaders and CEOs getting together to drive competitiveness of a region in the way that you all did. Could you share with our audience, you were one of the founding members and you chaired that organization, what the thought process was, and, I think probably most importantly, are there things that people could replicate in their own communities?
Yeah, at first it was for me one of the most rewarding involvements that I've had, and when you have that kind of an experience and you can say again it's changed your life, I'm not sure many times people find that in the civic involvements that they have. So the group really came together because a couple of thought leaders, one from a foundation, another from McKinsey, another CEO, convened a group of us to say, geez, seems like we have chambers of commerce, but they're kind of focused on more their local communities and maybe some lobbying, and we have governmental units, but their thinking is short term. Who's thinking regionally? In Minnesota, we were fighting amongst ourselves over where was a business going to grow, competing between St. Paul and Minneapolis, and instead of looking at the bigger picture of what does economic vitality look like in a region, how could we be more effective? We had a lot of Fortune 500, but where would the future growth be coming from? Just thinking there were very few tables that brought together people from business-led, from governmental units, from philanthropy, and from education, but with a focus on longer-term view of growth, quality of life, and economic vitality. And so a number of us said, yeah, you know what, we're in. we're into, and for me, a healthcare person, I mean, if you step back even 10 feet from healthcare, you look at what are the determinants of health. They're all socioeconomic determinants of health. Where you lived affects your health more than any other single thing, almost or as much as genetics. So it really has a huge impact on life and health if you're living in a place that's thriving. And I ended up getting involved early on. We were able to be part of some research looking at disparities. So disparities along three dimensions. One, geographic disparities, so impacts on income, education based on where you live, then also based on race, which ended up being really the big gap. And this is, 15 years before George Floyd was murdered. I think we began to start coming to grips with, boy, we don't have the place that we think we have for all the people who live here. And so started doing some work in that area, and also did Itasca as a whole did a lot of work on the topic of how can we create a regional approach to growth that will allow us to have a brighter future.
I can imagine a lot of alignment that comes from those types of meetings and having senior government officials in the room with CEOs talking about vitality and the kind of key levers.
Yeah, and all the way from little things like getting companies to, in our geography, agree early on. So this was before the practice was widespread that 401ks would be opt out, not opt in. From little things like that, where they sound like little things, but for some companies, they were pretty big things economically, to bigger things like, boy, if we don't start thinking differently about growth and moving beyond our local model, we aren't going to be able to contend for the research, development, small business startups that we really hope will come to our region and thrive.
Is there a moment or a project that you're most proud of from that work?
Well, 5 years ago, I would have said I was really proud of the work that we were doing on disparities.
Mm-hmm.
And now I would say, great, for many people, our eyes were open, but we didn't do enough. So I'm not so proud of it anymore. I'm still glad that at the time there were a few of us who said that's the number one issue that we have in our region is the disparities that exist based on race, place, and income. And the response was inadequate to the level of the problem. But it certainly changed me as a person. It changed how I led HealthPartners. It changed what we did and the practices that we put in place very early on.
There are few examples that I can think of today of private-public partnership like that. I think as you appreciate your candor and also talking about the challenges and looking at the challenges, even if the organization isn't able to get as far as it maybe needs to, at least it got somewhere. And a lot of communities wouldn't have the mechanism to be making strides forward.
Great point. And I would also say there's also the behind the scenes, the fact that the mayor knows the CEO of company X and the relationships exist where they didn't before. And some of those cross-governmental and private sector initiatives, I don't think we'd have the level of transit that we have in our marketplace now if we hadn't had some of that work that went on actually for quite a period of time through Itasca.
Amazing. As you think about advice for other regions, anything stand out, whether it's goals to set or how to get started creating something like an Itasca if our listeners are interested in doing so?
As with most things, I think it takes, someone who's willing to be, or some people who are willing to be champions of doing that kind of work, willing to convene people, willing to find the places of common ground. We did a lot of work of shared education, to your earlier point. Those shared experiences where you're learning together and then talking about what you can accomplish together, those can be very powerful and not that hard to do. I mean, every region has its own issues and topics of importance and challenges. And I think it became a place that people wanted to be. And so people prioritized the Itasca meetings because they knew they'd be learning something important and participating in a meaningful way. And so it became a desirable forum for many leaders in the region.
If you think about where we are today in this moment, are there goals that we should have? If we take the Twin Cities as an example, but maybe it's also applicable for other regions, what should an Itasca be working on today? Has that changed through the pandemic and in all of the events of the last couple of years?
I still think there is importance in geographic vitality and longer term thinking. And for most, not all, but for most regions, the recovery of cities and what cities are going to look like. And within that city footprint, the availability of affordable housing and businesses that are doing well and growing, that continues to be a huge challenge, maybe even bigger than before. And so I think most cities are talking about it, making sure that those are public-private forums. That would be incredibly helpful. And then I think, too, there's an ongoing challenge, one that Itasca tackled in some smaller ways, but hasn't yet been able to impact in a bigger way. What does education need, effective education need to look? What changes would be helpful? Those are daunting because they're political conversations to have, too. And
Yeah. Challenging times ahead on the education front. In technology, one of the things that makes it so challenging for us right now is it's not clear what the next platform is. We know that we're going to be automating accounting work, but it's not the cloud or the mobile platform or the early web platform. We don't know exactly how agents are going to be structured, best practices for all the change management to come. But then so what should we be teaching high school and undergraduates right now that they're going to need in 3-5 years? That's a very difficult thing.
Do you think they're getting what they need right now in terms of ability to learn and change? And
I would point to our interns, and I think it's been challenging. I think it'd be very thoughtful for young people out there who might be listening about what your internships are.
Oh, boy.
Because we're at least, if you're interning at a technology company or a large company that's dealing with the change, you're at least right there on the cutting edge of the change. And those things usually take a couple of years to get back into the university system. So, I think this is one of those times you want to be right on the edge of what's emerging.
Yeah, a lot of work to be done in that area, I can see.
That's for sure. Well, if you would, any advice, and you've served on numerous boards, public companies, private companies, nonprofits, any advice for CEOs in our audience who are thinking about taking those first board assignments and broadening their impact on their region and on the economy? What was helpful for you? How did you make some of those decisions?
First, I think it's incredibly important to have those opportunities. And I know that I was better in my job because I served on boards where sometimes I would learn, this would be a good way to approach this challenge with my board. And sometimes I would learn, boy, don't go there. That would be a big mistake with my board. And in general, I think also understanding the analogies across different industries, it helped me see how people in another industry would solve a problem that was fundamentally similar to the one I was facing. And it helps you have a little cohort of people who are in a similar job, because you then end up networking with other people who have jobs like yours. And I think that's incredibly helpful. So first, do it. A big priority, do it. And then I think it happens best if, first, more and more, I see corporations using search firms. So, maybe 10 years ago, using a search firm for a board member was not as usual. Now it's routine. And so, yes, people join through networks, but they're personal networks, but more often through a board search process. So I'd make those connections for corporate boards a priority. I'd make the personal networks work from the standpoint of serving on other boards that are either smaller corporate boards or not-for-profit boards. And so I almost feel like, especially for people who've been in the same industry their whole lives, I think it should practically be mandatory to try to get a perspective about the outside world through one of those pathways. And I know both you and I feel that way about our work. It really gives you a different dimension.
It most definitely does. And it sounds like concretely getting to know the board search partners in your area or in your domain.
Absolutely. So whoever, it seems like many of the people that are doing the great executive searches are on the flip side of their companies. They've got a similar structure that's doing board searches.
Excellent. Well, I think that's probably a good place to leave it. Thank you so much, Mary, for joining
thanks,
us on the
Jason.
show. And join us next week for another conversation on what it really means to be in the CEO chair.